Understanding strep throat, what it is and how it spreads. Strep throat is a common infection. It affects the throat and tonsils. This infection is contagious. This means it can spread from person to person. Strep throat is caused by bacteria. These bacteria are called group A Streptococcus. They are also known as gas. When someone with strep throat coughs or sneezes, tiny droplets containing the bacteria are released into the air. These droplets can infect others when inhaled. Touching surfaces contaminated with the bacteria, and then touching your mouth or nose can also lead to infection. Strep throat is particularly common in children and teenagers. It's important to understand how strep throat spreads. This knowledge helps us take steps to protect ourselves and others. The bacterial culprit Group A, Streptococcus. Group A Streptococcus bacteria are highly contagious. They thrive in the warm, moist environment of the throat. Once these bacteria enter the body, they multiply rapidly. This leads to inflammation and irritation of the throat tissues, causing the characteristic symptoms of strep throat. While gas bacteria are the primary cause of strep throat, not all sore throats are due to this bacterial infection. Viral infections are a more common cause of sore throats. Unlike bacterial infections, viral infections do not respond to antibiotics. Therefore, it's essential to determine the underlying cause of a sore throat. This ensures appropriate treatment. Recognizing the symptoms, sore throat, and beyond. The hallmark symptom of strep throat is a sudden severe sore throat. This sore throat is often described as scratchy or painful. It can make swallowing difficult. In addition to a sore throat, other common symptoms include fever, swollen tonsils, and headache. The tonsils may appear red and inflamed, sometimes with white patches or streaks of pus. Swollen lymph nodes in the neck are another indication of strep throat. These lymph nodes may be tender to the touch. Some individuals with strep throat may also experience stomach pain, nausea, or vomiting, especially children. Section 4. Seeking diagnosis. Throat culture and rapid tests. If you suspect you or your child may have strep throat, it's important to see a doctor for diagnosis and treatment. A doctor will begin by examining the throat for signs of infection, such as redness, swelling, and white patches. To confirm the diagnosis, a throat culture is often performed. This involves swabbing the back of the throat to collect a sample of secretions. The sample is then sent to a laboratory to check for the presence of Group A Streptococcus bacteria. Results from a throat culture usually take 1 to 2 days. In some cases, a rapid strep test may be performed. This test can detect the presence of strep bacteria within minutes. Section 5. Treatment and recovery. Antibiotics and home care. If strep throat is diagnosed, the doctor will prescribe antibiotics to kill the bacteria. It's essential to take the full course of antibiotics as prescribed, even if symptoms improve before completing the medication. This helps ensure that the infection is completely eradicated and reduces the risk of complications. In addition to antibiotics, several home care measures can help relieve symptoms and promote recovery. These include getting plenty of rest to support the body's immune response, drinking plenty of fluids, such as water and broth, to stay hydrated, gargling with warm salt water to soothe the throat, and using over-the-counter pain relievers such as acetaminophen or ibuprofen to reduce fever and pain. Section 6. Preventing strep throat. Hygiene and other measures. Preventing strep throat involves practicing good hygiene and taking steps to minimize the spread of germs. Here are some essential preventive measures. Wash your hands frequently with soap and water for at least 20 seconds, especially before eating, after using the restroom, and after coughing or sneezing. Use hand sanitizer if soap and water are not readily available. Avoid close contact with people who are sick, especially those with sore throats or respiratory infections. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Avoid sharing personal items, such as utensils, cups, and toothbrushes. Clean and disinfect frequently touched surfaces, such as doorknobs, phones, and toys. If you have strep throat, stay home from work or school until you are no longer contagious, usually 24 hours after starting antibiotics. Get vaccinated against pneumococcal bacteria, as these bacteria can sometimes cause sore throat similar to strep throat. By following these preventive measures, we can reduce the risk of getting and spreading strep throat and other contagious illnesses.